In this video, I'm going to walk through what we typically do for a patient when we're doing their workup, as well as how we interpret some of the data we get from the instruments that we use. The first test we do on a patient is usually the OptiMap. That is what takes the picture of the back of their eye. So go ahead and scoot up as close as you can to this bar here. Go ahead and turn your nose to the left and take your right eye into the hole there. Follow that target in. Good. You're going to go in until that target turns green. Eyes open wide. Blink. Eyes open wide. And then the last part here we're going to do is a scan. Go ahead and blink. Eyes open here. Keep them open. Perfect. You can sit back. So here what you're seeing is an image taken by the OptiMap. You can kind of see, we can zoom in here. We can see various layers, but right here is the retina, and then these are the blood vessels that flow through the eye. This right here is the optic nerve. That's where all the blood vessels leave the eye, so we can zoom in on that there. So that's the optic nerve of a healthy eye. And then this right here, it kind of looks like a smudge. That is actually the macula of the eye, and that's where all the good clear vision comes from. And in that area, we only have cones, which are very good for color vision. This is an example of the next OptiMap image we take. This one does it more in a black and white sort of coloring. And what we're looking for here is this glow. So if you can kind of see in the middle here, it's like a white glow. That shows us that there's not a lot of buildup in the eye and that the eye is healthy. This right here is an example of an OCT scan that we do on the eye. So when we scroll through, we can actually see various parts of the retina. It's almost like taking an ultrasound but with light waves. So when we scroll through, this little dip right here, this is the macula. And then this right here is the optic nerve where the blood vessels leave the eye. This is an example of an OptiMap image from a person with macular degeneration. As you can see in this area here, it's not a clear smudge like it was on our images of a patient with normal eyes. As you can see here, this is an image, an OptiMap image of a person with diabetic retinopathy. And what that means is that they have these little hemorrhages in their eyes from the blood vessels. So you can see in these little spots here that those are hemorrhages. If we take out all of the red color in the image, we can actually see those hemorrhages a little bit better. So the next test we do here looks at the cells on the patient's cornea. Go ahead and put your chin on the left chin rest there, forehead all the way up. Good. Now adjust this so that your eye is right in the center there. Follow that chin rest down. I'm going to have you blink a couple times and then keep that eye open wide. Good. Keep that eye open here. Perfect. You can sit back. This is an example of what we get when we do the cell check on a person's eye. So we usually do this for patients who wear contacts so we can make sure the cells on their cornea are healthy. This also tells us the number of cells that they have. And for the patient we had in her age group, this isn't a good amount of cells. We want them to be small and we want them to be relatively the same size. So the next thing we look at is the patient's baseline prescription, which is what this does, and this also looks at their corneal topography. Go ahead and put your chin on the chin rest and forehead on the white band there. Good, we make sure they're lined up. And then we're going to bring this in close to their eye. You're going to see a hot air balloon in there. Go ahead and keep looking at the top of that hot air balloon. Go ahead and blink, eyes open wide. So this is one of the results that come out of us using the autorefractor. This is the example of the corneal topography. So as you can kind of see through here, almost in an hourglass shape, is a little bit different topography than on the sides. So this is what leads to having an astigmatism when you have different curvatures across the lens of your eye. So you have different prescriptions throughout the lens. This is an example of what we get printed out from the autorefractor. So this gives us the patient's baseline prescription. As you can see here, their spherical prescription would be minus 0.75, and then their cylindrical prescription, which is the astigmatism cause, would be a minus 0.25 on the 124 axis. So the next thing we're going to do here is look at her glands on her bottom eyelids. Those are called her meibomian glands. Sometimes if those aren't functioning correctly, that contributes to dry eye. Go ahead and put your chin on the chin rest there and forehead on that white band. Okay, there's going to be a bright light here. Okay, I'm going to have you look up for me. I'm going to put a little pressure on that bottom eyelid. You can sit back. This is an example of what we would get from doing the mammography, which looks at the meibomian glands on a patient's bottom eyelid. So as you can see, these little white stripes here, those are the meibomian glands, and we want them to be relatively the same size, and we don't want a lot of gaps between them. So these ones are fairly good. There's a little bit of disorder going on right around here. You can see here the various degrees of meibomian gland dysfunction. So the top would be a mild case, which is probably what we were looking at previously. The middle would be moderate, where there's a few gaps between where the glands exist, so those little dark spots there, and a lot of disorder. And then the bottom is an example of severe, because as you can see, there's not a lot of meibomian glands there at all. The next thing we do is check the patient's visual acuities. This lets us know how well they're seeing and if they're seeing 20/20. I'm going to have you cover your left eye for me first, okay? And you always want to make sure it's covering their eye completely. And looking up at that screen there, what is the smallest line you can read?
ONRKD.
Good, so that would be 20/20 because she was able to read the bottom line. Go ahead and switch eyes with the covering. And what about here? What's the smallest line you can read?
VGHZS.
Good, so that would be 20/20 and then she missed 1, so 20/20 minus 1. I'll take that from you. And then with both eyes, can you read the top line there?
HDKCR.
So that would also be 20/20 vision. This is an occluder. This is what we have patients cover their eyes with when we do visual acuities, as well as when the doctor comes in the room. He has them cover their eyes so he can look at how each eye is functioning on its own. This is the card that we use to test patients' near vision. So as you can see, it goes from very large lettering to very small lettering. And then it tells us over here if it's 20/20 vision versus, let's see, 2800 vision. So that kind of gives us an idea of where their vision is at. The next thing we'll look at is how well the patient can see stereo, which is their depth perception. So I'll have you hold the book here and put on these 3D glasses over your glasses. And then I'll be like, and here's the key here. So we're going to ask them questions. They're going to tell us which circle jumps out at them. So if you look at these diamonds up here, tell me which circle jumps off the page towards you.
The bottom, left, bottom, top, top, left, right, left,
Good.
and bottom.
Try that one again.
Top.
Okay, I'll take that from you. So then she got right 8, so we would take her score as 50 seconds. The next test we'll test her color vision. So we use Ishihara's tests to do this. And they show plates with numbers in them to tell us if they can see color or not. Tell me what number you see here.
12, 8, 5, 29, 74, 7, 45, 2, nothing, 16, 35, 96.
Good. So she can see everything in color. So the next test we'll use this tonometer, which tests the pressure in their eyes. So if you can see this little tip on the end here, it's actually going to bounce off her cornea. Okay, so I'm going to have you look straight at that Z there. It's kind of going to tickle a little bit. So we get close enough to her eye, and then it gives us the pressure reading, and we go about 6 times so we get the reading. This is what a typical exam room looks like. Right here we have the exam chair, so that's where the patient sits for their exam. And then this right here is an example of a slit lamp that the doctor uses to look into the patient's eye. So he can look both at the front surface of their eye and the back of their eye. To use this to look into the back of the patient's eye, he has to actually get another lens to focus the light on the back of the eye. So this right here is called a phoropter, and that's what the doctor uses to put various lenses in to help the patient see clearer. So he can change the lens and go back and forth between different lenses to see which works best for the patient. This is called the MPOD test. So what we do here is we have patients actually look inside here where they see those 3 dots in there, and then they have to focus on the middle dot and tell us if there's any sort of movement within that dot. So if there is movement, they have to click their button, which is on this remote here. The MPOD test actually tests to see the thickness of a person's macular pigment. So this is not a test that tells us if someone will have macular degeneration, but it gives us an idea if they are already predisposed to having it. It also tells us how they have been affected by blue light and UV light. This instrument is what we use to measure the prescription in a patient's glasses lenses. So this gives the doctor an idea of what the glasses are at and if we need to change them or how much of a change it will be for the patient. This instrument here is called the Oculus. We don't use this one very often, usually only on patients with severe dry eye who need an ocular surface evaluation. It can do a couple of different things. It can take an image of the patient's corneal topography. It can measure their tear meniscus height, so how much tears are pooled in their eye at a time. And it also measures their tear evaporation rate, so it tells us how long it takes for them to have their tears evaporated on the surface of their eye when they don't blink for a long period of time. This instrument here is one of our special testing instruments. It's called the Humphrey Field Analyzer. So what this does is we actually have the patient put their chin here and forehead on that band, and they actually look in the back there, and it's kind of like a giant bowl that they're looking in. And this one actually tests their field of vision. So they look straight ahead and they click a button anytime they see a flash in their peripheral. So this gives us an idea of what the patient's blind spot might be. This instrument here is called the Cirrus OCT. What this one does is takes an OCT scan of the patient's eye so that the doctor can get a better view of their retina. What this does is it basically takes an ultrasound but with light waves of the patient's retina. The Claris here is our last special instrument that we use, one of our special testing instruments. It is also not used very often. What this instrument does is takes a very high definition picture of the back of a patient's eye. So if they're having any small hemorrhages, we can get a better view of what those look like in the back of their eye. So this takes a better image than the OptiMap does, but it does come at a cost. When the patient gets this done, there's an extremely bright light that flashes them to take the image. The good thing about that is if they blink or any of their eyelid gets away, it actually takes the picture through their eyelid, but it is very, very bright and they will not be seeing very well for the next couple minutes. They'll be seeing spots. Overall, I really enjoyed my practicum experience at Nebraska Eye Institute. I was able to learn a lot about not only eyes, which is what I'm looking forward to working with in my future as an optometrist, but also how to work with patients as well as various databases and how to schedule and all the aspects that surround an optometry practice. The experience that I gained was very valuable, and I think it will be extremely useful for me in my future.